Hello. Thank you everyone for joining us this evening. My name is Jocelyn Coggin and I am the current president of Duke Desarrolla. Desarrolla is an undergraduate organization whose goal is to connect Duke and Latin America. We do this through two main components. First, we participate in several community development projects involving partnerships between Desarrolla, Duke students and faculty, and community-based organizations in Latin America. Second, we create forums and speaker events on campus to discuss relevant news and topics pertaining to Latin America. The remote nature of the semester has had its challenges, but has also prompted us to expand our projects in new ways. We are working to maintain our community-based partnerships remotely and continue collaboration. Additionally, we are taking advantage of the remote platform to invite speakers such as Dr. Fabriga, who are located far away from Durham, North Carolina. We would like to thank the Duke Center for Latin American and Caribbean Studies, as well as the Duke Center for International and Global Studies for this collaboration. The event will be translated live into Spanish by Emily Maroon, Vice President of Desarrolla. Now, we will hear from the Faculty Advisor of Desarrolla, Dr. David Boyd, who will be introducing Dr. Fabriga. Dr. Boyd is a professor of the practice of global health at Duke. He is an expert in global health, cross-cultural medicine, indigenous health issues, and maternal and child health. Recently, his work has focused primarily on working with Mayan communities in the highlands of Guatemala to improve health and educational outcomes. Dr. Boyd has supported Desarrolla over the years with his insights regarding health and work in Latin America. We are honored to have him here and introduce tonight's speaker.
Hello, everyone. Welcome. And Jocelyn, thank you for that nice introduction. It is for me a really great pleasure to introduce and have here my friend and colleague, Dr. Ricardo Fábrega. Dr. Fabriga is a medical doctor from Chile, and he has had an extensive and illustrious career in public health. He was, in many of his iterations, a former director of the National Public Health Institute in Chile, and actually the vice minister of the Ministry of Health. His work has focused on improving health services, universal access to healthcare, primary healthcare, and people-centered healthcare services. From 2014 to 2018, he worked at the PAHO headquarters in Washington, D.C. Now, for those of you not familiar with PAHO, PAHO is the Panamanian Health Organization, and it actually functions as the regional office in the Americas for the World Health Organization. PAHO, by the way, precedes the World Health Organization in its founding. It was founded much earlier. Now he is working at the PAHO WHO office in Lima, Peru, focusing almost exclusively on the pandemic in Latin America.
Well, yes, I'm working now in Pan American Health Organization. I am in Lima, I'm fighting against COVID-19, and I had already the opportunity to discuss these issues in April with David. And at that time, I was very pessimistic. That's the truth. I thought things would go very wrong, and unfortunately, I was right. But I hope I can explain why I now have some hope, not certainty, but I have hope that we will do better from now on, okay? Well, that's I will divide my presentation into three parts. First, a summary part of the situation of pandemic in our countries now. Then I will focus on what happened when the pandemic arrived. And finally, I will tell you what are we doing now and how we face this current phase. So here we go. Let's first talk about Latin America in the North American region. I'm referring mainly to Mexico, okay? I have friends in Quebec that they said that they are Latin American of the North, but it's not true, okay? I'm gonna talk about Mexico. Mexico had a slow rise. This is Mexico here. okay? Do you see the arrow? Miguel? Miguel? ¿Ves la flecha? Are you hearing me? Please, some feedback.
¿Qué necesitas? Estamos viendo todo perfecto.
¿Ves la flecha que muevo?
No, we cannot see it. No, no la vemos.
Now, you see?
Ahora sí, la vemos.
Perfect, thank you. Then Mexico had a slow rise. This is Mexico, okay? But it's really a problem because Mexico is disturbed because they are starting to rise the cases now in this moment again, and they never finish the first wave, like US. That is US, okay? That is Canada. They finish the first wave and then they start the second wave, okay? That's Canada. But Mexico is rising again, but never go down, okay? That's Mexico. I can talk with a little more detail about it. This is Mexico. Mexico case continue to increase. You can see here in some states in the north and in the center of the country. We have a lot of problems in this moment there. And the epidemic curves in some states is really worrying. And we are, I am not optimistic about Mexico in this moment, okay? This is Central American subregion. Central America, Panama started first here, okay, in April. Several countries managed to control the situation until June here, but then came a sharp rise. Costa Rica, look at this, wow, okay, it's a very big curve. And the Costa Rica performed very well initially, okay, but suddenly they had a lot of problems. We thought that is because Nicaragua, we don't have good data about Nicaragua, so I don't know what is happening there. We thought that was very bad early, but we don't know really, okay? And here is Belize. Belize is still rising here. And Honduras, Guatemala, and Salvador are in the middle. We don't know what is going to happen, but we are worried too about the countries. Nicaragua, you can see, we don't know, okay? We don't have data about it. Then we can go to South America. The Andean region and Brazil, okay? The north of South America. We don't talk about Latin America. When we talk about Latin America, we don't talk about Guyanas, okay? We just talk about Andean region, Bolivia, Peru, Ecuador, Colombia, Venezuela, and in this case, Brazil, this giant. Okay, as can be seen here, the case rate is per 100,000 population have been high first in Ecuador, this is Ecuador, then Peru. Peru have this shape, and in September we have a second peak in the same wave, okay? We are still in the first wave, but we have a first peak and a second peak here. This is Brazil. Brazil was the worst in July, but it's going better until October. They are rising again. Peru is going down. Ecuador is going up in this moment. And Bolivia here. I don't know what's going to happen. This, okay. Now, Bolivia is this, and this is Venezuela. We don't have good data from Venezuela, really. Okay? And finally, this is the southern cone, 4 countries: Chile, my country, Argentina, Paraguay, and Uruguay. As you can see here, Chile wasn't able to contain the epidemic in April. In April, we have problems, and then we have a peak in June and July. It was very hard, but now it's going okay. Argentina managed to control the situation until June, and then the virus escaped and did not stop until mid-October here. This is going down the last 14 days until last Friday. Tomorrow I'm going to know what's happened this week, but I hope that it's going down. I hope. I don't know. This is Paraguay, better. And look, this is Uruguay. You can see it? It's for real. It's not a lack of data. Uruguay don't have a first wave. It's our case of success, okay? If we can talk about a good story in Latin America, it's Uruguay. And we are really happy for them. Okay, and then, in summary, that's the situation in Latin America with COVID, with the disease. As of November 2nd, 2020, 6 countries in Latin America have the highest mortality rates in the world. Peru, Bolivia, Brazil, Chile, Ecuador, and Mexico. Okay? The other countries, Belgium, Spain, US, and UK. That's the situation 3 days ago. Well, let's see now what happened when the pandemic hit in our countries. That was the moment of truth, at least for our health systems, but also for our political system. And the truth is that we had many problems, and still have. I must say it was not as surprising that when someone asked us in March what was going on, what was going to happen, we knew we are going to go wrong. That's the truth. This is so because we knew that the systems were not prepared and that our population social conditions are not good. But additional problems occur almost everywhere in our countries, to a greater or lesser degree, okay? And that's the real problem for us. First, the dominance of a health model, the health model predominance, okay? The health system focuses on preparing to treat the severely ill people, reinforcing intensive care units, but not to prevent the spread of the disease. In some countries we have and still have that problem. Other problems, I have a lot of problems here. This one is serious monosolutions, but I mean, many hope that there would be a medical solution. They was looking for a good solution, one just solution. And this approach led them to look for one solution, one after another, without implementing any in a good way. And they are still looking for a magical solution, okay? Like vaccine, but they are not today. And so some countries never really do what they must do in that moment. A lot of dichotomic thinking, some sensationalism. It was very heavy because some authorities, there was a lot of hype, a lot of empty marketing, proposals that attracted attention, but they were not effective. And if were effective, they never made with due seriousness, okay? Just for the photo. The other thing is that there are a lot of anxiety about normalcy. I think that is still a big problem. We have a lot of people using different solutions that are not solutions, different treatments that are not really real treatments, and it's still a problem. People want to know if some drugs is useful, but in this moment we know that almost never is really useful. Okay, just a few treatments we have now, but just for certain cases, several cases. There are a lot of complacency in the first moment. Okay, speeches denying the event seriousness and loose interpretation of the data without using the precautionary principle. Complacency. It was really hard until June, or in some countries until today, and others with a reactive attitude. Many did not react until the problem was unmanageable. That's the truth. We knew that what could happen because we saw what happened in Italy and in Spain weeks before America Latina. But many times the measures were not taken until it was too late. We wasn't proactive, not cautious. It's a problem, and well, it's a problem. It happens. And then there are other people that live in a fatalist mode. Okay, they think that nothing is nothing to do, and so they do nothing. That's the problem. So these problems, we saw these problems everywhere in our countries, and I think that there is nothing more unsafe for people than a poorly prepared system that also reacts badly in an emergency. That happens in our countries. It's sorry, it's sad, but it's the truth. Well, for us, it was very important this inform. It's an inform from experts about pandemic. A world in disorder. It was in September. We see this inform. All of the above, what I said, which we already wrote it in July and August reports, and was ratified globally by the Experts Council for Preparing Pandemics response in the United Nations. So we are not exaggerating. What I said is not an exaggeration. That is the same that the experts said some weeks later in this inform. I recommend strongly to read it. Okay, look at this. This is not the worst virus that we as humanity may have to face in the future. This is just a warning. It's not it's a phrase from the expert from the United Nations, and I'm sure of this. When I fight against Zika, I was waiting for something worse, like COVID, but I'm still waiting for another worse virus. That's the truth. Well, I don't want to talk about this in this moment. I'm going to talk about this. That is the problem in this moment in our countries, economic situation. The GDP of Latin America and the Caribbean will fall by 9.1% in 2020, the worst crisis in history, our history, really. This drop is not uniform. Peru will have here, look, well, Venezuela is another case, okay? It's not just pandemic, but Peru, 13, Argentina, 10 or more than 10, but it's not uniform. You see Paraguay, just 2.3, and Uruguay, 5, okay? This is a situation now, but some experts say last week that these projections are a little bit optimistic, okay? So we are in a real problem at this moment. Here is another way to show the situation. We are in this moment, you see, our problem will back 10 years. We are going to be in the same problem that like 10 years ago here. Okay, and here we have another view that was in 1914, that was in 1930, the Great Crisis. You remember? The books of history talk about the Great Crisis of 1930, but in this moment it's worse. And that is very serious because the political instability and social damage that follow these fluctuations are very severe for our countries and for our people. So this is a real problem. This is about poverty, increasing poverty. We will reach 231 million people living in poverty at the finish of this year. This is the projection of CEPAL. And if you see the extreme poverty will grow 50%, okay? From 11 million to 11% to 15.5%. That the situation is it's a big problem for us. And we know that there are different health and socioeconomic effects according to group of population and its response capacity. Okay, that's, you know, some people, the possibility to work remotely, overcrowding and lack of water and sanitation increase infection risks for the poor and vulnerable. It's true, and we are seeing increasing risk for death for the poor and vulnerable from lung diseases, cardiovascular, and diabetes. Obesity is a problem too. Informal workers with a large participation of women, young, indigenous, and adolescent migrants do not generate income and lack savings, so they can't maintain social distancing. They need to go to work in public transport, and crowding is a mess. The first cases of COVID-19 were registered in groups and urban areas with higher income, more resources, and better health conditions, but that changed a week later. That's because the rich people they went to Europe in our summer, so they arrived with the COVID-19 in the most of our countries. Not in Peru. In Peru, we have a lot of European tourists, so we have problems from the beginning everywhere. New cases are registered in low-income areas, more vulnerable economically, and with less access to health services. In this moment, we have a lot of problems in that kind of areas. For the poor, quarantine have worse consequences, social and economic, and are more difficult to comply with. We can't sustain quarantines in poor neighborhoods. That's the truth. Okay. Well, but not everything is bad. You can see here some examples. We have good people working hard in all parts of our countries. You can see health team works like this. And they are working with vulnerable people, families, and helping them maintain and achieve healthy conditions and implement public health measures. We fight to maintain vaccination programs, control of pregnant women here. And well, at PAHO, we accompany the health teams in the field. Believe me, this is me. Okay, I am the one here. We are fighting against COVID everywhere with our people, and our people don't give up. Okay, we are going to maintain all measures, and I am a little optimistic now in this moment. Is different the second wave? Well, probably yes. Yes, we believe that we can do better in the second wave. We are better prepared. We think that we can avoid a second wave. We do the things well. We have learned a lot. We have proven technologies and logistic chains that have been revealed. We hope to work to avoid the second wave, or at least make it less lethal. This graphic from Europe, in this moment, the second wave is less lethal. And we hope that we can do the same for different reasons. We can talk about it later, okay? What do we do now? That is our main objective, avoid the second wave, okay? This implies complying with set of measures well and having the collaboration of all actors. Is not easy, but that's our objective. We are ambitious about it, okay? We need to do a lot of things. The most important thing is not lowering the world, okay? There must be clear awareness that the pandemic continues. We are still in pandemic, okay? And at the same time, that's possible to live with the virus. We saw this cases cabinets. We think that we can maintain a lower level of cases in our countries if we do the things well. For that, we need to focus on what works. No more, no less, without exaggeration, but without falling short. We see that is possible, and we are going to fight it. This is the general strategy. You know about it. It's the same everywhere. We need to flatten the contagion curve and simultaneously strengthen the health system to respond to demand. But in this case, not just from hospital, we're going to put in action primary care. We think that that's the key. We need people working the territory with families, communities, and we are prepared to do that at this moment. We don't have that 6 months ago. And that's the priorities in the response. That is our scheme, PAHO. And we are going to do these 4 things, okay? Save lives, organizing health service, plan workforce research, maintain infection prevention, optimize clinical management along the continuum of care with a better primary care, with an approach of primary health care, and assure the supply chain. We failed this in the first weeks of the pandemic, but now we think that we have a better condition. And we are going to protect healthcare workers at work and in community, and we are going to slow spread, detect and isolate cases, trace and quarantine contacts. This is easy to say, but it's not easy. Engage actively with community, implement social distancing. Okay, all of this measure, we can do that in this moment better than some months ago. And we need to reinforce epidemic intelligence. And we have better information now, okay? We have really better information. And his next couple of tasks is to put the transmission. Of course, you know that is really important. This implies population and social measures that go beyond the health sector, but we think that now we have the cooperation of all sectors to avoid the second wave. Includes case identification, contact tracing, retrospective, prospective, and isolation. We need help to do that. Several countries have achieved this so far by very important time to prepare the system and even putting the pulse of the epidemic at this moment. At least Uruguay is our best case, and they until now they don't have a first wave. That's the truth, and we hope that we are going to do the same that they do for the first wave, and we think that we can do it for the second wave. Okay. Following the example of Europe. The main measures, if you ask me about three measures to make a summary, we think that these are the three. Identify the cases, the contacts, and isolate them all. Okay, that's really important. You need to do that. Is the key. Okay, for people who have already learned to do that, we also look at the most dangerous events, and we are emphasizing retrospective traceability, because retrospective traceability is really works. So this is the first focus. Okay. The second is generate a COVID way of living together. It is possible, and we think that we are going to do it better now. And we must keep the capacity of the system to avoid collapse by placing strong support for outpatient management, and not only COVID-19, but also for essential services like vaccines and a lot of other issues. We have at this moment a problem with diphtheria in Peru, because the fall in vaccination make us a risk for other diseases. So I think that that we need to support not just COVID-19, but essential services, and I'm doing it in this moment. And we have the support from economic Minister of Economics, and not just from health sector. In this moment, we really have the cooperation of all the sectors in our countries. Maybe a little late, but it's hope for the second wave. This, in finishing, as I say, there is a wide range of possible interventions here in Spanish, but the situation is, the important thing is to keep in mind the Swiss cheese model. Okay, that is our big orientation. All layers are important because each layer is not perfect. Social distancing, wearing masks, washing hands, okay. Rapid testing, we have very good testing, antigenic testing now. Some whole measures, we can put it in thinking about the Swiss cheese model, and we think that it's going to go well in the next weeks. I hope. Okay, I'm not sure, of course. And we are still working hard. We know that the pandemic continues. We will resist as we try to reconfigure our health and social systems. We have a proposal to do better from now on, and we have a lot of support to do that. We have more knowledge and technology, but also a lot of exhaustion, internal division in our countries. is true. It is not possible to know if we will succeed, but we are going to do our best. We appreciate each of you for your attention, and we hope that in some way, from where you are, you will support the strengthening of the system from a strategic perspective, based on people, families, and communities, not just from hospitals. We need a strong primary health care approach to fight against this pandemic, COVID-19. Thank you all for your attention.
Thank you so much for that presentation, Dr. Fabrega. And now, if you don't mind, we have a few questions, which are in the Q&A box.
Where are the questions? Here, Q&A. Okay. How? What is the key of the success? Uruguay. Okay. They did it well. That's the only reason. The measures that we know that are good measures, they implement it and they do it well. In social distancing, the people, not just the government, the people help to fight against COVID-19. They had a very good risk communication, so the people understood what is happening and put in practice the measures. Okay, they have a good social situation. It's true. They have better cities. They have more space. There are not much people there. They don't have poverty like us in Lima or in Sao Paulo or in Rio de Janeiro or in some cities in our countries. They don't have Guayaquil. Of course, that's true, but they did it well. They have a very big city, Montevideo, and they have crowd in this country, but they maintain the distance. If you maintain distance, you don't have crowd in a closed space. If you wear mask when it's needed, not always, but when it's needed. When you wash your hands, you need to have water for that, okay? Or that could help. But if you do all of these things, you can avoid the spread of the virus. And Uruguay did it, and did it very well. And this is one area. The other area is the response of the epidemiological area, the public health authorities. They had a very good epidemiological intelligence, and they have a very good system to trace the cases and isolate the cases and trace the contacts and quarantine the contacts, and they did it really well. Okay, and Uruguay people is incredible people. They really have confidence in their authorities, and they did what they need to do. How can people who work in the informal sector be supported during the pandemic? That was the main problem in our countries, because our governments are really weak to identify who are the people who are in the informal sector, because they are in the informal sector. They live in a high manner to the state. They don't pay taxes. They don't have social security. They don't have identification in some cases. So it's not easy to identify them and help them, okay? That was a very big problem here in Lima. The government decided to help people with a very different ways. About money, they want to give money to help the people here, but they can't reach the poorest and the informal in a good way. They failed to identify the people who really need the help. And the same is happening in more or less way in the other countries. Our governments don't have the control of the situation and are prepared to help the people who really needs. It's different to explain in English for me. Okay, I can explain it in Spanish. Believe me, I am very smart in Spanish. But the situation is that the state is weak. That's the reason. We don't have a good government with institutions. We don't have good institutions to help people. We are not prepared to do that.
Dr. Fabriga, I have a question regarding Peru. You are in Peru, and the Pan American Health Organization is located in Peru, and Peru has shown to be the country with the highest rate of that to COVID. Could you give us a sense of why that happened in Peru? And also, because you are there, make a comment about the impact that COVID had in the government, right? We are seeing calls for the president to leave and even to impeach him through a political process. Could you just comment on that? Thank you.
Well, I am in Peru, and I prefer to be polite, okay? But, okay, I'm gonna say, the government do their best, okay? The problem is the weakness of the institutions. Years, decades of weakness of the state, okay? So they don't have in some areas the institutions to reach and to take decisions to do the things well. Okay, for example, they have a lot of decentralization, and they are not a good governance to put together the ideas from governors and Minister of Health. And the governors are not prepared to manage this situation. That's the truth. And ministers are prepared, but they don't have the control of the situation. That's one thing, okay? That's one explanation. The other explanation is that we had a lot of old people, okay, that is living in a very bad conditions. Really poor, okay? And so this virus go and spread everywhere where you have old people in bad conditions, you are not going to go well. It's an accident. So, and in Peru, you have a lot of this, okay? In Lima, you have a lot of this problem. And the young people must go to look for something to eat and return to home where the old people is living with them. And that was a problem everywhere in our peripheric neighborhoods. And we saw it, and that happens, okay? That's happening. So I don't think that is the president's fault, okay? The problem of the impeachment for the president is another problem. It's about other things. It's about another fight, okay? It's not about pandemic. The pandemic, in this moment, we are under control of the pandemic. We are finishing the first wave, but the problems in the political area are increasing, okay? And the situation here is a weak state, weak social conditions, a weak health system, very good system without the minimum to do the things well. Now we are better in this moment, but we didn't have oxygen in March, okay, in April, in May, in June, we didn't have oxygen, okay? That was the situation. It's difficult to understand, but that's what happened. Nowadays, we have rebuilt the logistic. We have supply for everything. We as World Health Organization help to do that. And we think that we are in a best moment nowadays. But who knows, if we are not alert, we can have problems in just a few weeks from now. We hope that it's not going to happen. Okay. Oh, of course. Could the pandemic present an opportunity for countries like Peru to push for an expansion of public healthcare capacity? Of course. I think that if this is not the I think that this is the moment to wake up. Okay, our authorities, our political system needs to wake up and understand that this is not fair. They can do it better, and they need to strengthen the health system. They can do it, and they need to do it now. It's an opportunity. I hope that that all the political sectors really push for a new health system in the next years. Okay, we are working that deal. We are working the deal because we think that all the people, including the executive, more executive about the public health, in this moment really are seeing the situation and really knows that we need to do that. Yes. In other words, could the pandemic put healthcare at the top of the public and political agendas? Yes, we think that in Pan American Health Organization, and we are working for it. Okay, we have meetings with congressmen. We have meetings with the president, with the ministers, with the big wealthy people of this country. That they, how can I say that? They saw that health is not important for them because they can travel to Miami, okay? But in this moment, they realize that they need health system here in Lima. That's the truth.
Thank you, Dr. Fabriga. And something connected to that is that you show us this very interesting graph of economic growth, GDP growth through the century, through the 20th century to this part of the 21st century. And we saw clearly there how during the and the post big depression era of the 1930s and 40s, a great increase of wealth in the entire region. And we remember in history, in Latin American history, for all of our students, we show that was the moment of the creation of the welfare state, the first wave of industrialization across the Americas, that by the late 1980s was going down due to global forces that then moving to this new moment of neoliberalism that has also created a lot of wealth, so in some areas of the social classes for sure, but that had abandoned in health issues this idea of social health that was built in the 1950s and 1960s as what you were saying, the precautionary principle, that public health was about taking care of the problem before, right? Social health was doctors and the whole medical sector looking at the good health of the population as a whole. And now we are in a moment on individualized health, right? We have different systems of health in Latin America that are more related to service offerings, right? They offer services of health, but we have seen the weakness of the state as the one that really have to push the idea of precaution and the global and the health of populations rather than these business transactions that are happening in many of the systems. Could you comment on that?
Wow. Okay. I have another question from Viviana. I know Viviana. Hi, Viviana. She's an Argentinian doctor, family doctor. She worked with you in Duke. Es un verdadero gusto que estés allí, Viviana. Feliz de verte allí. Okay, she's asking about family medicine and well, we are pushing for family medicine in our countries, like PAHO, like Pan-American Health Organization, because we are really convinced that this is the solution for, in our countries if we want to have good primary care. We need a good primary care. We need a primary health care approach for the whole system, but it's just possible if we had a very good doctor with the community, and a very good doctor is a family doctor. Okay, what is going to happen? I don't know, of course, but in some countries we are having advances, and we think that we are going to be in a better position from now on, and of course we as PAHO are pushing for more family doctors in our systems. And here in Peru, we think that we are going to have good results in the next years, because this year they call for family doctors. The Minister of Health called for family doctors to fight against the COVID in the territories. So I think that this first step is going to be followed by other measures that are going to strengthen the family doctors in our systems, in our system in Peru. But not just in Peru, in Chile, and in Chile, I think that is possible too. And in other countries, we have an indicator to know if the system is better, that implies the family doctors in our systems. So I am not sure, of course, Viviana, but we are fighting for it. And of course, I am totally convinced that we need family doctors to have a better system in our countries. Miguel, the first thing is that I don't know if I'm going to respond but the first things for me and I want to say is that we are not poor countries, okay? We are rich countries with bad elites and bad norms that concentrate the wealthy in fewer people, okay? We have an history of concentration of the wealthy in just some areas of our countries, in our capitals, in certain neighborhoods of our capitals. And that is going to finish sooner or later, okay? It's not possible to maintain a model that is functioning in that way. So this is going to change everything, okay? In this moment in Peru or in Chile and in other countries, we are really changing our mode of live, fleeting, okay? And we think that we are going to abandon models that concentrate the money in just a few people, okay? It's not normal what is happening here. It's not normal, it's not what happens in Europe. It's not what happens in other areas of the world. This is really strange and can't go on. Okay. Comment about the introduction of vaccines already being distributed. Vaccines. I hope that, okay. First, we don't have a vaccine yet, okay? That's the first, we need to think that we are not going to have vaccines for all the people that need it in the whole next year. That's the situation, that is my scenario. We are thinking about, we are going to live with the virus without sufficient vaccine for at least 12 months from now, okay? That's is not pessimistic, it's realistic. And of course, I hope that we have vaccines before that, but I don't know. I am not sure that we are going to have sufficient vaccines for our people and safe vaccines, okay? We can have vaccine, but safe vaccines and effective vaccines in just 2 months from now. I think that is not possible. We're going to have some of them. I really hope that the scientific reach a very good solution for this problem. But for now, we are preparing the logistic to have a good campaign of vaccination. We are preparing this, but I am not sure that they're going to have sufficient vaccines in just a few months. Okay. We are thinking in 12 months. Is there a way to improve trust during the pandemic? Good question. We think that the answer is yes. It's possible. It's possible because we are not in panic in this moment. Okay, the panic is gone. In the first moment, we was in panic, okay? All of us. In this moment, people is more cold, okay? It's thinking. So, and it's reaching. And it's reaching she is listening about the good instructions from serious doctors. And we have serious doctors that are helping us to give the right message. So in our country, we think that we are going to have more confidence in the new recommendations and that the people is going to follow the recommendations. Yeah? We have a lot of different opinions in the first moment. It was confusing, but in this moment, we think that is more clear what we need to do and what is useful and what is not useful. Okay. Your recommendation moving forward, what are the key changes in ecosystems like Peru? Wow, it's another, okay. Zoila asked me about what are the key changes that an ecosystem like the Peruvian one must take. Okay, it is another webinar, okay? It's not easy to respond that in just 1 minute. So if you want, you can write me to my email and I can answer it, but not now. It's a long answer, okay? Another one, I don't know if I read everything. How does this affect people going to operate in the Yes, how can we impact other health sectors? Other health sectors in Latin America? What do you mean, Peter, with other health sectors? What that means, other health sectors? The health sector for us is just one, private and public, but just one health sector. When I talk about health sector, I'm talking about everything in health sector. The health system, you can have private insurance, you can have private clinics, hospitals, public hospitals, but it's just one sector for us, okay? In our language, okay? So I talk about the whole sector. Okay, I think that is all. Jocelyn or David.
Thank you so much, everyone, for coming. And thank you, Dr. Fabriga, for that excellent talk. We are so honored to have you with us tonight and really appreciate all of the insight you bring and information about the pandemic.
Okay, thank you for your invitation. Nice to see you. One day, I hope I want to go to North Carolina again, but not for now.
It's probably best. Thank you, everyone. Have a safe night.